Hey everyone, my name is Ashley Spalla. I'm with Miles for Hips. Welcome back. We are doing another interview for hip dysplasia around the world. I'm with Dr. Susana Braga from Brazil, and we're going to do some questions for you today. Dr. Braga, would you like to introduce yourself and what you in your practice a little bit?
Sure. Hi, Ashley. It's really nice talking to you and Maya for Hips. So I'm talk about a little bit about my history and how I came to work with DDH. So I'm Susana. I came, in fact, from countryside Brazil, a southern state. I went to med school there, and I chose orthopedic. I mean, it was a very natural process for me because I had a great example at home. My father was orthopedic surgeon. And during my residence program, I came to São Paulo to stay at Santa Casa. Santa Casa is a very traditional hospital. It was the oldest healthcare facility in São Paulo and is the birthplace of orthopedic surgery in Brazil. And it was in Santa Casa that I got inspired by many brilliant teachers. Our group was and is reference for DDH, and I could really understand the reality of our country, like in the public service. We and seeing this like 25 years ago, and we had so many cases of late diagnosis. Always struck at me, like lots and lots of surgery actually. And sometimes these kids, as you know, they go through multiple surgeries during their childhood, and it's very sad. We can witnessing like the suffering, how it impacts their lives. And there were times that we could not even treat because it was like too late. And it was like heartbreaking. So I think that each of these cases, they left a mark in me. That was a point. And from that moment on, I embraced the prevention of the age-related consequence. And my purpose, I dedicate myself in this, and I'm studying this more deeply. So today, I have the opportunity to work in a private practice in Hospital Israelita Albert Einstein in Santa Casa, that's a public facility, and both have like excellent med schools. And more than that, as we were talking before, I have a clinic, a private practice that's focused on the DH with a very committed and passionate team. Moreover, this year I have the opportunity to serve as the vice president of the Brazilian Pediatric Orthopedic Society. So, I mean, lots of things.
It's quite incredible. And it's amazing just to see a female orthopedic surgeon, especially in DDH. It's so heavily male dominated. To see someone is very impressive and a very inspiring. So um, tell us how you became interested in hip dysplasia itself.
So it was like seeing in these cases, and you know what? Imagine that you have a condition that you can change the natural history, like so strong, like the DH. When you treat it early, you know that you have like a perfect hip, a life, full activity, no worries. So I mean, if you have a late diagnosis, then all the problems come. So that's why it inspired me to follow this path.
I love that. Can you share information about how patients are screened or come to be diagnosed with hip dysplasia in Brazil?
Sure. I mean, first, let's talk a little bit about Brazil. So Brazil is a large country, it's the fifth in the world in area, the sixth in population. We have about 200 million people and 2.5 million babies born each year. 80% of our population depends on the public health system that's free, is the largest public healthcare system in the world, and is responsible for everything, like things, very simple things like vaccines to the most complex procedures like organ transplants. Unfortunately, we don't have a strong national screening policy. The current recommendation was to examine the newborns using the ortolani maneuver. And however, last year something very interesting happened. They removed this maneuver from our child health book. We have a child record book where we write everything from birth, and it was written like Ottolani maneuver, and now we don't have it anymore. On the other hand, the Brazil is something interesting because on the other hand, there are some cities that this clinical screening is mandated by law. So we have like, we remove it from the book, and then we have some place that we have to do it. And there is no strong recommendation from what to do with babies with risk factors, but that have no clinical finds in the physical examination. Well, I always try to remain optimist. So what I think is that when they removed the Ottolani maneuver, it was like, for me, it was like a breaking point, like a chance to rethink, to restart, and now using the most up-to-date science to see where are we going from now. When you think about the private practice, Ashley, it's different because in private practice, most of the pediatricians and orthopedic surgeons, they believe in selective ultrasound screening. So they do physical examination on everybody, and they do ultrasound in some risk factors that varies from professional to professional, but that's not a national guideline.
Yeah, that seems to be fairly common in the United States as well. Um, Once a patient is diagnosed with hip dysplasia, what would a typical care pathway look like in Brazil?
Well, we have to understand that our healthcare, let's talk more about public healthcare because that's what the problem is. Private access is much easier. But our healthcare system, it's very decentralized, which means that access varies from place to place. So you can have in one side, one very well-structured one-stop DGH clinic, and the other side, you can have like no pedi-orthopedic surgeons available that moment at that place. If you are in a maternity, if you're born in a maternity hospital, there has orthopedic surgery like in a big hospital. It's much easier. If not, the infant or the child is going to be referred to a specialized center. Then the appointment will be scheduled in a place that has the staff and the structure for the tests and the appointments. But then, Ashley, that's the key point, how long it's going to take. And it varies. It varies from place to place, but sure, it can lead to late diagnosis. That's something we don't want in this condition. Even more challenge is if the child has already a late diagnosis and needs a surgery. Then probably it's going to be a waiting line. So, I mean, it's very variable, but that's how it works.
Now, how long can some of the waiting lines be?
That's, I mean, totally variable. It can be like 2 weeks. It can take months. It depends on what type of care do you need. Surgery probably will take longer. And which place you are. Like if you are here in São Paulo, we have lots of facilities that accept the age cases. Maybe in other place you have less specialized doctors. So it's very difficult to precise a time.
That makes sense. What priorities or opportunities are there for hip dysplasia related care, research, or education in your region? And are you involved in or aware of any activities in your region to address these?
Actually, I think that we have like tons of opportunities here. And we are working two main fronts with the Brazilian Pediatric Orthopedic Society. So the first one is led by my friend Patricia Moreno, and she developed a questionnaire to better understand what our pediatric orthopedic surgeons believe and what they do in their practice, in public or in private. So out of the 700 orthopedic periorthos in Brazil, we got 300 responses. That's very good. The data is currently being analyzed, but I have a spoiler. I have brought some spoiler for us, so I took notes here. And so what we know is that 99% of the periorthos believe that all newborns should undergo clinical screening. 90% support that if the baby is breech or has family history, he or she should undergo ultrasound screening even with normal clinical finds. So that selective screening program. 89% prefer the graph method that we're talking about. So in Brazil, it's everywhere we prefer the graph method. 77% that works in public healthcare believes it's possible to have a time test there with no problems. But 20% of the cases, they think it may take a little bit longer than it was advised. But I mean, I think it's a good thing that it's possible to have the test. One thing that everybody talked about was that they have some difficulty about having a good image, ultrasound images. So it talks about a little bit of capacitation of training people. That's good. And 67% of the ped orthos prefer to analyze the image and not just the report. They like to understand the hip to see the image. And finally, 98% of the ped orths in Brazil believe that we need a national DDH screening program and guidelines. So I mean, everybody knows what we need. And so this is one front. And the second front is what Daniel Maranhão is doing. He's working with a very dedicated team, and he is reviewing the literature, and he is developing these guidelines, taking account what Patricia found. So they are working together. And the next step is take this guideline, so what the society believes and wants for the pediatrician, obstetrics, radiology, so we can make it like some more national policy, some national program. So yes, that's lots of work to be done. We are trying, we are moving forward, and that's, I think, is the most important thing now.
It's amazing. That's awesome. Very impressive. What is your vision for the future of hip dysplasia?
Well, that's we were talking before. So my personal opinion, I think that universal ultrasound screening or every baby is going through not only clinical, but ultrasound screening is the ideal approach. It's not feasible now in Brazil, but I mean, it's like a journey. A journey, sometimes it's going to be. It's going to be becoming easier, and so it's going to happen at some point. I truly believe that many people like to say that you have over-treatment when you do like this universal screening. But I truly believe as you get this ultrasound very good, you don't have over-treatment. You make it not so common. So it's not, I don't believe it's a problem. And of course, as we talked before, there's no screening method that's perfect for any condition, but we can for sure reduce the late diagnosis and surgery. That's a very important point. Moreover, what I believe is that AI is going to play a major role here. Not only making like the test more accurate, because we have these, like AI is helping to read the images and all that stuff, but also it's going to support the research. So, I mean, it's going to make research faster, and it's going to help in developing the guidelines and the treatment protocols, because we need this. In sum, I think that's like a bright future for our kids.
I would agree. Well, thank you so much for your time. It was wonderful talking with you. Thank you, Dr. Braga. And thank you everyone for joining in on another interview with Miles for Hips. Have a great day.